Hi guys, welcome back to my channel. My name is Jeremy Ray, and we're gonna be doing my testosterone shot together. It is Thursday, and Thursdays are my days that I do my shot. And yes, a little intro to my my tea days. I started taking tea on September 10th, 2020. What was it? 2015. I was 17 years old. So September 10th, 2015. Yes, 2015. I was 17, and when you start testosterone when you're under 18, you have to have parental permission, and I have very supportive parents, so they allowed me to start hormone therapy, HRT, before I turned 18. So that was pretty cool. Very, very grateful for that. So I've been on T for almost 12 years now. How old am I? I'm 18. I'm not 18. 28. I've been on T for 11 years. 11 years. 11 years. So yeah, let's get started. What you're gonna need is testosterone. Testosterone. And I believe I'm starting on a new vial today. So you'll need this. And then the next thing is, well, some people do this differently. I will show you how I do it, and I will explain how other people do it. How I do it, actually no, we'll explain how other people do it first. How other people do it, sometimes people will hold on, let's back it up. Testosterone is an oil, so it's very thick. So trying to draw up testosterone with a small needle is kind of difficult. So sometimes your doctor will prescribe you a syringe with extra needles, with like larger needles to draw up the testosterone. What? Oh, they want food. I'll feed you in a little bit after I do this video. Alright, so sometimes your doctor will prescribe you the syringe, and then they will prescribe you a larger needle to switch on the syringe to draw up the testosterone, just to make it easier. And then they will have you switch back to the other syringe to inject it, to make it so it won't hurt as bad. You're not injecting with a very thick needle. Yeah, I can show you how thick this needle is. This one is a 18 gauge, and I usually just use a 25 gauge. So this is a very big needle. Trigger warning, if you are like scared of needles, don't watch this part. I will show you compared to, this one's a 25 gauge syringe, or needle. I will show you the difference. So the pink one, and this pink one, is the 18 gauge. And 18 is bigger than a 25 gauge, and the blue one is the 25 gauge. I don't know if you're gonna be able to see these, but let's see. Ooh, that is a big needle. I've actually not looked at these. You can tell. See the difference? The pink one is the 18 gauge, and the blue one is the 25 gauge. And your doctor would have you... Okay, sorry, I had to change the battery on my camera. Typically, the doctor will prescribe you the bigger needle just to draw up the testosterone, and then you'll switch back to the smaller one just to inject. Because you don't want to shove an 18 gauge needle into your thigh. That is gonna hurt. Like, that's really gonna hurt. That's not what I do. For the 11 years that I've been on T, I don't do that. I just draw it up with a 25 gauge and I inject with a 25 gauge. I don't do that all switching the needles and everything. Yeah, I don't mess with that. It works fine with me. It works fine for me. I've never had any issues with it. I've never needed to switch the needles, and I think I did it once and I really didn't find any difference. This one you just have to pull back farther and like hold it longer. It just fills the syringe slower. That's the only difference, but it works just fine. Okay, so now I'm just gonna talk about, or show you how to, just making sure I was actually filming. There's train. And I mean this video in no way meaning this to be a like a teaching video. This is just for like entertainment, or like no way as medical advice. This is not meant to be medical advice. You get your testosterone, you take it out of the box, and yes, I do have a new vial this week. Oh, focus. It's not focused. Well, that's okay. So, you get to take the cap off. This cap off. And technically, since I just took the cap off, it's sterile. But for the sake of the video, you get an alcohol swab. And you clean the top of the vial just to sterilize and decrease the risk of infection and stuff like that. So it's clean. And then you get your syringe, and you open your syringe. And I always like these are like push-on syringes or needles. So, and my dose is 0.3 milliliters. I take this once a week to equalize the pressure in the vials. You need to pull back to your dose, and then inject the air into this, and then pull the testosterone out. I'm doing this like without sitting down, so I don't have like a table to rest everything on. So it's kind of different, because I'm usually doing this at my desk. So, anyway, syringe, vial, syringe, in, turn over, push air in. Alright, and now, remember, testosterone is very thick, so you're gonna have to pull. I pull all the way out, and you make sure that your needle is in the liquid. And I don't know if you can see, filling up pretty slowly, just because it's very thick. And that should be enough. And then I have 0.4 in there, so I need to push back to my dose. And then that's that. Okay, and I'm gonna put my needle back, my cap back on. So now, the fun part of actually injecting it into my thigh. This type I'm taking is intramuscular. I believe there's other types that you actually put in like your fat on your stomach and stuff. But the type that I take is intramuscular, so it has to be put into a muscle. So I take it in my thigh because that's like the biggest muscle. So I'm going to switch camera angles and point at my thigh so you can see me poke it into my thigh. Okay, now that you're at like a level that you can see my thigh, you get another alcohol swab. Focus. Another alcohol swab, and you're gonna clean the area. I'm gonna inject it like right around here-ish. So we're just gonna clean an area there. Let it dry, because if you inject while it's wet, it's gonna sting. At least it does for me. Okay, take the cap off. And the best way to do it is just like a stab it in really quick. Because if you go slow, it's just going to hurt more. So just 1, 2, and quick. In. So ready? 1, 2, in. Ooh, that one hurt a little bit. And it usually does not bleed. This one did not bleed. See? And then I usually like massage it a little bit. That's that. Now, I did it. I took my shot, and it's on. It's done. I don't have to do that for another week. And, so, clean up. You always put the vial back in the box, because this is light sensitive, and if you leave it in, like, direct sunlight or any light, it could, like, spoil, and it won't work as well. So, that's... And then this, the syringe, you take the needle off. This part can go in the trash, and this part, the needle, the actual needle, needs to go into a sharps bin. And yes, everybody's dose is individual and unique to their bodies. If you take too much testosterone, your body can actually turn it back into estrogen. So it'll do the opposite of what you're trying to make it do. So if you're taking a smaller dose than I am, I'm taking 0.3 milliliters per milliliters, whatever. I'm taking 0.3. If you're taking 0.2, and you're like, oh, I'm just gonna copy him because he's taking more, I think I need to take more, I would not do that, because your body is unique. And if you take too much testosterone, your body will turn it back into estrogen. And it's important to follow your doctor's instruction. And they're the professionals, right? They are the ones with the degree. I am not the one with a degree. What the heck? Oh, my cats. But yes, this was not intended for, this was not intended as medical advice. It was just kind of like a fun video of like how I do my shot. Again, I've been on HRT for 11 years, almost 12. So how many shots have I done? Let's see, 52 weeks in a year times 11. I've done about 572 shots. That's a lot. Oh, okay. But if you enjoyed this video, comment down below, leave a comment. I love to hear you guys. I love to hear comments. But yeah, subscribe. See you later, guys. Stay safe. Bye.